All Australians were expected to be as insouciant during the COVID pandemic, when our leaders were appearing on television every night trying to scare the pants off us with frightening statistics and assurances that they had a killer virus under control.
First things first, there are 1,438 new cases notified yesterday, all locally acquired. That brings us to a total of 11,018 active cases across Victoria. This is more than a 50% increase on yesterday's daily numbers, and I'm sure that'll be a great concern to all Victorians. We've been very clear these numbers would go up. They go up faster, of course, if people don't follow the rules.
Overnight, we recorded 7,075 new cases. That means in total we have 38,742 total active cases in Western Australia. We now have 180 people in our hospitals across Western Australia, 6 people in intensive care. One woman in her 80s passed away on Sunday, but this was only reported by West Australian Police yesterday, sadly, so it's reported in today's numbers.
We have 49 active cases. We've done over 14,900 tests. So once again, if you're sick, stay at home and go get a test. So that's imperative. And 15,631 vaccines were delivered by Queensland Health yesterday.
But suddenly all that command over the statistics and concern for your well-being has disappeared. Here is Queensland LNP Senator Gerard Rennick in a Senate committee hearing in November, asking the Bureau of Statistics if it is possible to connect vaccinations with the deaths of Australians over the past 2 years. Or, to put it another way, whether it is possible to calculate the increased likelihood of a person's death by how recently they'd had the vaccine shot.
Is it possible that you can track those deaths by vaccination status, number one, and then track between the time of death and the time of vaccination?
That question was asked of representatives from the Australian Bureau of Statistics, and they took the question on notice. Well, it's 6 months later. Has Senator Rennick received a reply? Let's get him on and ask him. Senator Gerard Rennick, welcome to the show.
Thanks, Fred. Good to be here.
Firstly, Senator, did you ever get a reply from the Australian Bureau of Statistics about the correlation between deaths and vaccinations?
Look, I've got to be honest, I've been on the road for 2 weeks and some answers have come in for my questions on notice, but as of 2 weeks ago, no.
Right.
I haven't got an answer on the correlation between the date of death and the date of vaccination.
Well, this was raised, you raised that in a committee back in, I think, November. Was that right?
That's right. I raised it with both the Health Department and the Australian Bureau of Statistics.
Well, if I'm not mistaken, those figures could be extremely informative about the relationship between vaccines and possible fatal consequences. Do you agree that there could be a lot of information in these statistics? And if they're not being forthcoming, what's the story?
I agree. There could be a lot of information there. And if you think about how readily the governments across Australia were prepared to deliver COVID cases and COVID deaths on a daily basis via numerous press conferences from each state, you'd think that they would be able to provide the same amount of information in regards to deaths, reported vaccine deaths as well as deaths in general.
Yeah, well, I mean, they were, as you say, they were extremely diligent, giving us the frightening statistics on a daily basis throughout the so-called pandemic. But now...
and by the way, Fred, not just the statistics, but also the statistics about COVID being in the sewerage. Don't forget that.
Oh, that's right, yeah. Well, it looks like the statistics are in the sewerage now because you can't get them anywhere. You can't get anyone to help you.
That's exactly right. And we should also point out that the virus was going to hunt down the vaccinated. Are you scared yet, Fred?
Petrified.